हेलो दोस्तों, आज हम डिस्कस करने वाले हैं कि जो आर्टरी जो लोअर लिम का जो भी सब आर्टरी है उसका हम एक ब्रीफ इंट्रोडक्शन विथ रिवीजन करेंगे। तो फर्स्ट हमारा लोअर लिम का आर्टरी स्टार्ट होने से पहले हमको एक ब्रीफ कॉन्सेप्ट जानना चाहिए कि कौन सा कॉन्सेप्ट कि फ्रॉम हार्ट व्हाट आर द आर्टरीज आर गोइंग and forms the lower limb arteries. So we know this, if we consider this is the heart, this is the chamber of heart, this is the apex and here the base, and from this part is atrium and this is ventricle. So from heart the systematic aorta is come and it provide what come arch of aorta, then down to form descending thoracic aorta, which undergo also under some point it continue as a abdominal aorta, and here from abdominal aorta is divided into two division, that is common iliac artery. So we know that this is right side common iliac artery, another side is left side common iliac artery. So in this way we describe only brief introduction of the arteries, how it enter to the our lower limb. So in this part, from this common iliac artery, left common iliac artery, there are two branch are another is external iliac artery, another internal iliac artery. So IIA, internal iliac artery. So external iliac artery give rise to our artery which is known as femoral artery. This is our first part of the lower limb artery. लोअर लिम्ब आर्टरी we discuss. So in लोअर लिम्ब आर्टरी हमारा फर्स्ट आर्टरी आता है फेमोरल आर्टरी. सो वो कंटिन्यूशन कहाँ से होता है? इफ वी कंसिडर दिस इज इंग्विनल ligament. So after crossing inguinal ligament, external iliac artery is continue as a femoral artery. Understand? So femoral artery is arises at the mid inguinal point. So mid inguinal point, from mid inguinal point the external iliac artery is continue as a femoral artery. So that is the course and beginning of the femoral artery. Okay, then femoral artery having now what happened? The femoral artery we discuss only lower limb artery. So we discuss only the lower limbs branches. So we discuss briefly about femoral artery branches. What are the femoral artery branches? Mainly femoral artery give rise to 3 superficial and 3 deep branches. Okay, so 3 superficial. What are the 3 superficial artery? So one is superficial circumflex iliac artery. Circumflex iliac artery. Another is superficial epigastric artery. Another is superficial external pudendal artery. Pudendal artery. So in this way we discuss about the 3 superficial branches of a femoral artery. So as the name circumflex iliac artery, so it is what it causes. So in the iliac bone it causes the circumflex, means it causes the anastomosis. Its main function is the anastomosis around iliac bone. So here the superficial epigastric means it give the branches towards the epigastric region, whereas superficial external pudendal norms, when we encounter pudendal means we go towards the our external genitalia. External genitalia means external genitalia organ. So in our vagina, that type of a sex organ, that things they are supplied that area. So 3 deep. What are the what is PFA? That is profunda femoris artery. Profunda femoris artery. This is the what? Another each one is our what? Muscular artery. Another each one external pudendal artery. Deep external pudendal artery. So remember that superficial pudendal artery, that is external pudendal artery, and external pudendal artery in a deep. There is external pudendal artery is common in both superficial and a deep. So we retain it first. So then circumflex artery that is superficial, whereas profunda, in the profunda what happened that these are arteries where it is supplied. Mainly it is supplied at the femoral, on the course of the femoral artery. It is firstly enter to the thigh through the femoral triangle, then it continue through the adductor canal. So what happened, those artery which are a branch of the femoral artery are first given in the femoral triangle. So in the femoral triangle these are the branch are given. So in the femoral triangle the deep branch, which is a profunda femoris artery which give mainly 3 perforating and 2 special branches. What are the 2 special? Means circumflex artery, that circumflex artery, because it we said 2, so one is lateral circumflex, another is medial circumflex. Descending genicular branch was given by this femoral artery deep branches. So external pudendal artery is common in both superficial and deep, whereas the circumflex artery is one is in the one circumflex iliac is present in the superficial part, whereas in the deep the profunda femoris is having 2 part, that is lateral circumflex and the medial circumflex. Then all those things you can remember. Epigastric is another term. So external EPC means external pudendal, external epigastric. These are mnemonic you can remember. I remember by this way, you can remember it. Then after it enter the femoral artery enter to the knee by crossing a opening which is known as a magnus opening. When adductor magnus opening, it after crossing the adductor magnus opening, it continue as a popliteal artery. So in popliteal artery is so much easy. Why? Because you only remember one thing, that is genicular. If you remember genicular, then we remember divided by 2. One is superior, another is inferior. So genicular term is under on the superior genicular, inferior genicular. In superior also there is medial genicular, superior medial genicular artery, another is superior lateral genicular artery. So in the inferior also there is also 2 things is present, that inferior medial and inferior lateral. In this way you can, if you remember genicular, you can remember all those branches of the popliteal artery. So another one under the genicular, but superior inferior not, but it is middle. So if you remember one genicular term, you can understand, you can remember all those branches of the popliteal artery. So why it is important? Because popliteal artery is the content of a popliteal fossa. In the popliteal fossa, if you retain the this branch, there is so much mark fetching will be occur in the long question part. Also in the short question in the NEET PG exam also it is asked as which is the not a part of the popliteal artery. You can remember just by remember one term, that is genicular. Then popliteal artery, here I mention that the popliteal artery, now if we, this is adductor magnus opening, now femoral artery is continuous popliteal artery. So popliteal artery is divided into 2 parts, anterior tibial artery, and a posterior tibial. So anterior tibial and a posterior tibial artery. So what happened in the anterior tibial artery, what it device, it give towards the anterior part of the tibia. So all the muscle of the anterior compartment of a tibia are supplied by anterior tibial artery. tibia. Anterior compartment of all the muscle are supplied by anterior tibial artery. So you can remember just by knowing one anterior tibial artery. So anterior tibial artery, which is the small terminal branch of the popliteal artery, whereas a large terminal branch is the posterior tibial artery. Continue as a dorsal pedis artery. How can I say that? So you should remember, because when the anterior tibial artery enter to the leg in the part of the medial malleus and the lateral malleus, after crossing this, it continue as a dorsal pedis artery. Okay, then in the lateral malleus and the medial malleus, it give rise two branch. What are they? One is lateral branch, another is medial malleolar branch. Okay, then you can understand by that you feel it under the leg when you press your thumb on the lower part of the ankle joint, you can feel it this arch. Then it continue as arch formation, which arch? Plantar arch. So in this way we discuss the anterior tibial artery branches and its continuation. So anterior tibial artery, after that we go towards the posterior tibial artery, which is the largest branch of the popliteal artery. Here one thing I should mention, that is this artery, that is peroneal artery. So peroneal artery is what? Peroneal artery is the branch which is coming from the popliteal artery at the popliteal muscle medial border. So it is assists to the dorsal pedis artery. So it is a supportant artery towards the dorsal pedis artery, and it assists to the dorsal pedis artery by entering the interosseous membrane. So here the interosseous membrane is present, then it assists to dorsal pedis artery, means it is joined to that. Then posterior tibial artery is the largest branch, which having two branch, that is one is our dorsal pedis artery, one branch is enter, this branch is known as a lateral, that is lateral plantar artery, another is medial plantar artery. So in this thing, another is lateral plantar. So lateral plantar get anastomosis with the dorsal pedis artery, which is the continuous of anterior tibial artery, and forms plantar arch. So this plantar arch divides and forms the provides the four plantar metatarsal artery, plantar metatarsal with adjacent giving branch towards the 2 digit. And a medial plantar artery, what it gives? It gives the digital branches towards the medial 3.5 artery, medial plantar artery. So it gives the medial 3.5 digits with it medial side of the foot, cutaneous branch, muscular branch towards the medial side of the foot. So in this way you can remember all those artery, and it terminate at the flexor retinaculum of the leg. So in this way we discuss about mainly four arteries, that is femoral artery, popliteal artery, then it is divided into anterior tibial, posterior tibial. Anterior tibial is enter into dorsal pedis artery, whereas posterior tibial having medial plantar and a lateral plantar. So lateral and medial plantar, they are mainly supplied to the sole. If you do not remember anything, you can remember only that medial plantar gives the 3.5 digits of medial side of the leg, means medial side of the sole, whereas lateral plantar arch, which is combined with the dorsal pedis artery and supply and forms the plantar arch, which is the main gives four metatarsal branch, and with with two adjacent side of the digital branch. So including that, the big toe and a little toe also it is supplied the plantar arch. With it we also remember that what are the three superficial branch and the three deep branch, what are the branch name with its course also we just discuss. So in this way we topic cover with